So now let's talk about amebicides. So these are basically the drugs which are used to kill amoeba, and amoeba is a unicellular water parasite which is present in stagnant water. And now let's talk about its route of admission. So it enters through the fecal-oral route, which is its route of transmission. Now for the classification of drugs which are used in amoebiasis. So we have luminal, systemic, mixed, and combination drugs. So for the luminal drugs, please remember the mnemonic of DEP. So for D, we have diloxanide furoate. For I, we have iodoquinol. And for P, we have peromomycin. And then for the systemic ones, please remember DC, like he is the DC of a university. So for D, we have dihydroamethine, and for C, we have chloroquine. And then now let's talk about the mixed one. So the mixed one, for this, I have a very interesting warning. This is a metro train station, and this is someone called Orny. And Orny is very timid, so she has missed her bus. So we have in nitroimidazoles, we have metronidazole and timidazole and ornidazole. Now let's talk about their combinations. So for the combinations, please remember that we are going to get metronidazole, peromomycin, or a tetracycline. Now let's talk about their chemical classification. So for that, I have a mnemonic for you, which is NEDHAT. So for N, we have nitroimidazole. For E, we have amethines. For D, we have dichloroacetamides. And for H, we have halogenated hydroxyquinoline. For A, we have antibiotics or antimicrobials. And for Q, we have quinolones. First of all, let's talk about N, which is for nitroimidazole. So for that, we have metronidazole, timidazole, and ornidazole, as we have discussed before. And then we have something that starts with an E. This is an amethine. So in the amethines, we have amethine and dihydroamethine. And then we have something that starts with a D, which is dichloroacetamides. So for that, please remember DET, as in a duct. So for DET, for the D, we have diloxanide furoate. And for C, we have lefamide. For T, we have tetrozam. And for E, we have etofamide. Now let's talk about H. So for H, we had halogenated hydroxyquinoline. For that, we have dioquinol and diiodohydroxyquinone. Then we have antibiotics and antimicrobials. So for that, please remember PET. So peromomycin, erythromycin, and tetracycline. Now let's talk about the quinolones. So for that, we only have chloroquine. Amoeba can also cause amoebic cysts in the brain as well as in the liver. Now let's talk about the mechanism of action of metronidazole. So metronidazole, how does it work? It is amebicidal, it is bactericidal, and it is trichomonicidal. So unionized metronidazole is readily going to be taken up by the anaerobic organisms cells. Why anaerobic organisms cells? Because it is selective for the anaerobic organisms cells because of its ability to reduce the metronidazole to its active form intracellularly. For that, we need electron transport proteins for this reaction, which are only present in the anaerobic bacteria. So reduced metronidazole is going to disrupt the helical structure of the DNA, which is going to inhibit the nucleic acid synthesis of the bacteria, and that is going to lead to the bacterial cell death. So metronidazole is equally effective against dividing cells as well as non-dividing cells. The pharmacokinetics of the metronidazole is very important. So it can be given orally, through IV, or intravaginally, or even topically. And it is completely and promptly absorbed after oral intake. With the exception of the placenta, metronidazole penetrates well into the body tissues as well as the fluids, specifically the vaginal secretions, the seminal fluids, saliva, and breast milk. So therapeutic concentrations are also achieved in the CSF. And after oral dose, 75% labeled metronidazole is eliminated in the urine. Largely as metabolized, only about 10% is recovered as unchanged drug. So liver is the main site of metabolism, and 50% of systemic clearance happens with the liver.